So congenital heart disease is a child who's born with a heart defect. It's not caused by any injury or any disease. It's something that happens in the womb, and the baby is actually born with this defect. So there's no preventative treatment available for these things, and it's just a surgical correction that is required. Now, of the 150 children per year born with congenital heart disease, a large number of these children will die before their 5th birthday if they do not receive surgical correction. On the other hand, is if they receive the surgery they need, then their life expectancy becomes almost normal. And so these children can go on to school and education and university. And that's our goal, is to make sure that these children can have the corrective surgery and live a normal, healthy life. In the last 2 years, our focus has changed slightly because we have 3 visiting teams who come from overseas. We have a team from Australia, a team from New Zealand, and a team from India. And they come to Fiji and operate on children in Fiji. So in this year alone, 24 children have received corrective surgery, and we help with the logistics of getting these children to the hospital, making sure that they can travel to the hospital. Some children don't even have enough money to travel to the hospital for their treatment. We make sure the mothers get accommodation, and so the children being treated locally get all the support they need for the surgery. Those children who are not suitable for surgery in Fiji, we fund their surgery overseas. They'll either go to Indian hospitals for very complicated surgery, which can cost up to $40,000 Fijian. We have one hospital in India who provides free treatment, provided the surgery is available at that hospital. And in those cases, we only have to find accommodation and airfares. The very sick children of the age of from birth to 4 months are sent to New Zealand, and we do have some funding from the New Zealand government to help with their treatment costs. I have about 15 children who urgently need surgery, but our concern is also that the children receiving surgery are the older children, which means that the younger children are put on a waiting list and their condition worsens while we're trying to save the more serious cases.
Previously, we had funding from a big organization, and we had stopped getting access to this funding since 2012. Our foundation relies on the donors and some generous people who are willing to help us, to help these children that are listed with us to get corrective heart treatment and surgeries and all aftercare. The children are our future, and they have the right to live, and we have to help them. What we do is saving these children's life. It is always difficult, especially it's got to do with life and death.